Okay, good morning. I am going to go over a urinary tract infection with you. It's commonly known as a UTI. This is any type of infection that's in your urinary system. So it is most common in your bladder and urethra, and I'll go into why in just a little bit. So cystitis would be like a UTI of your bladder. That's from E. coli, usually to blame in your GI tract. Other germs may contribute to this, different bacteria, but most of the time it's that E. coli. And then if you have it in your urethra, it's called urethritis. That is also from different bacteria. Normally it's spread from your anus to your urethra. That could have something to do with wiping or sexual intercourse. Lots of STDs can also cause you to be more at risk for urethritis. And then a few other things that put you a little bit more at risk to get a UTI would be pregnancy, menopause, just because of the changes in all your hormones that put you more at risk, diabetes, just female anatomy. Men can get UTIs too, but most of the time it's more common in females just because of where your urethra is and having a shorter urethra, so it takes the bacteria much less time to get up to your kidneys and your bladder. Other things would be like genetic disposition, so if it runs in your family, different birth controls, any spermicidal, anything like condoms or lubricants, that can put you more at risk. Diaphragms put you more at risk. Any female products, I know if you're a woman, you've been told all your life probably not to use any of this, the good smelling bath stuff, so like bath salts, soaks, most of the time bath and body washes you don't want to use down there, douches, any like spray deodorants, anything like that can put you more at risk. So these don't always present symptoms, but most of the time you're going to get that burning when you pee, being uncomfortable, discharge. You can have frequent urination and sometimes in very small amounts. If it's colored like pink or red or cola colored, it can show symptoms of blood being in your urine, which would be a sign. Any pain in your abdomen, your sides, your back, anything like that. Sometimes people say they have pain during sexual intercourse. That would also be a symptom. If it is a severe case, you can have vomiting and nausea. Sometimes bladder stones and kidney stones and stuff like that would also be another symptom. So complications, normally really there's not going to be any crazy complications unless it is left untreated. So that would be just reoccurrent infections. If it's a male patient, their urethra can have some narrowing involved. If you're pregnant and have it, your baby can be at risk for low birth weight. You could have a premature child. Then of course, like the more extreme cases would be sepsis, so that's life-threatening, and when the infection spreads all the way to your kidneys, and then permanent kidney damage would also be something. So different things that your doctor's going to do to test for this would be, number one, a urine sample. So they would be just checking your white blood cells, your red blood cells, or just checking for any bacteria. If that does not suffice for them, you could possibly go for a urinalysis, like a whole lab urinalysis. So that would actually tell them more specifically which bacteria is affecting you, and which medications would help you clear that out. It can also go more advanced with a severe UTI, or when you're having them all the time, just recurrent, imaging. So MRIs, ultrasounds, CT scans, and that would just give him a better picture of your whole urinary tract. And then one other thing they do is a scope procedure, and that is just sticking a long tube in there just to see your bladder and all the way through your kidneys, so he can see everything. So the best, or the number one way that most people knock this out would obviously be antibiotics. They're going to be your first line of defense against UTIs. So simple infections, they use Bactrim, Macrobid. Sometimes they do Keflex, but lots of times that can prevent, or it can give more bad side effects than it will good. So normally it's more harmful, and we try to stay clear of that. If it's like a frequent UTI that you keep having, they might put you on a low dose antibiotic for 6 months, sometimes a little bit longer. If it is directly from sexual intercourse, they can give you like a single pill to take afterwards. If you're postmenopausal, they can do some type of therapy treatment with you. And then if it is a severe case, you would have to go to the hospital. They'll put IVs in your veins, and do antibiotics that way. So a few different things you can do at home, not necessarily with your doctor, would be to up your fluids. So drinking lots of water will help flush all that bacteria out, keep you hydrated. They say to drink cranberry juice. That is kind of touchy. I mean, I've been told to drink cranberry juice my whole life, but it is non-conclusive. So the people are still doing research over it, but we don't know 100% if it helps. It's probably not harmful, so they do suggest you do that. Wiping front to back is another one that just keeps bacteria from being spread from your anus to your urethra. Emptying bladder after intercourse is another one, so that's just another way to flush it all out. And then, like I said, the different female products, you kind of want to stay clear of that. Maybe change your birth control. If you're on one of those diaphragms or the spermicidal condoms, if that's what you're using, you probably want to get rid of that. So for your diet, things that could help a UTI would be the cranberries, blueberries, any juices that have those two in them, dark chocolate, yogurt, like a probiotic yogurt, water, like I said, and then things you want to stay clear of would be like spicy foods. You don't want to really drink anything real acidic or caffeine or caffeinated drinks. Coffee, stuff like that can irritate your tract more than it can help. So like I said, most of the time UTIs, they're not terrible. Like, you're going to be able to get rid of it most of the time. It's not going to have really, really bad side effects if you catch them early. Now, if they're left, no treatment, maybe you don't know you have one, or you just can't get to the doctor, that can have some pretty bad consequences, like life-threatening sepsis and stuff like that. But most of the time, you're going to be able to knock it out with an antibiotic. It's just something that females will get maybe at least twice in their life, if not more. So it is kind of common, but the good news is you can knock it out, and most of the time the effects will not be harmful to your life. So thank you.